What's up, Jonty?
Ben, you're still alive.
I'm still here.
Thank goodness. Myself and my extended family likewise.
Good for you. Nobody got sick? Everybody healthy?
We've had father-in-law had it, best friend and his whole family had it, whole bunch of folks.
What do you mean when they had it? They were sick?
It was minorly. Well, actually, my good friend said it was absolutely horrible.
Yeah.
He said, you don't want this. His wife and his 2 kids, 0 symptoms. They all tested positive, no symptoms.
That's the weird thing is some people will get it really bad, and other people in the same family won't get it at all. I just talked to a friend of mine last week. His wife had it. He was, sleeping with her in the same bed and all that, and they were close quarters. He didn't get it. So, this whole idea of even contagion needs to be questioned. The idea that some people get it, some people don't, implies that there's something else going on. There may be a viral infection, but there's something else in people's bodies that makes them more susceptible,
right,
likely to be symptomatic or not. So many questions here that are being raised. The bottom line is viruses are everywhere, Jonty. You know this. They're everywhere. You can't hide from a virus. So what you do is you support the body's ability to handle viruses. And you support the body's ability to handle viruses by doing all the things we talk about and we've been talking about on interviews and on George Norrie and on the Bright Side, and Dr. Wallach's been saying for years, you take care of your body. You take care of your health. You do the Mighty 90. You exercise. You don't eat McDonald's. You stay away from sugar. You drink lots of water. You meditate. You breathe correctly. I mean, there's so many ways that we can protect our bodies, and it doesn't require medicalization. One of the most important things you could do to protect your health, don't watch the news.
Right, sure.
Don't watch the news because the news, this is the mistake we make when we watch news. We forget that the news is there to entertain, to make money.
It's there to sell products. They're there to run ads and sell products.
Exactly. It's there as an advertising vehicle. It's there to keep you compelled, to keep you watching, to get you scared. It's not there to inform you. So if you're going to watch it for entertainment purposes only. Don't structure your life around the news or your thought life around it.
Well, Ben, here's something that's been on my mind a lot recently, and unfortunately I haven't quite articulated this as well as I want to. But we're not. I hope we're not transitioning. But there's this contest between those who treat the human being as a biological system, and those who treat the human being as a conscious entity, or a spiritual system.
Right.
So we're going from a society. I mean, I shouldn't say we're going. There's this conflict between those of us who want to be an individual with rights, and those of us who want to use every form of manipulation possible to get people to do what they should be doing or what they think they should be doing. When a lot of time they think they should be scrolling down on Facebook all day. So how can we get the biological entity to scroll down on Facebook every day? Well, you've discussed this a lot with the parasympathetic nervous system and things like that. If you scare the hell out of somebody, that's a great way to limit their consciousness.
That's right. Did you see Social Dilemma?
No, I don't think so, no.
Oh, you should need to see it.
Sounds like something I'd enjoy.
It talks about all the algorithms that are
used. Oh, yeah.
I mean, to hack into people's decision-making skills or decision-making abilities. So it compels them to do certain things.
Right.
There's even certain things that Facebook does to compel you to scroll, or to compel you to push a like, or to compel you to go to the next screen. They know how our minds work better than our minds work. So what you have to do is you have to take control of your consciousness as best as possible.
Right.
I mean, we are going to be influenced. It's hard not to be influenced, but as best as possible, take control of your consciousness so you can control your biology, because our consciousness modifies our biology. So the most important thing is don't go into fear. That's the most important thing. If something is making you feel fearful, be aware. Don't be fearful about fear. But be aware that something is making you go into fear. When you go into fear, your cortisol goes up, your immune system goes down. Really, it's as simple as that. So in a way, all of this promotion of fear is a way to almost guarantee that people are going to be infected or are going to be sick. because their immune system is suppressed. So building the immune system is critical. We talked about the parasympathetic nervous system. The body has two nervous systems. It has, just a quick review, it has the parasympathetic nervous system and has the sympathetic nervous system. The sympathetic nervous system regulates fight or flight. Under conditions of sympathetic activation, when you're fighting or you're fleeing, and also freezing, this is the third, it's actually the 3S, fight, flee, or freeze. When you're freezing or fighting or fleeing, your immune system is suppressed. When you're relaxed, the parasympathetic nervous system regulates relaxation response. The rest and digest nervous system, your immune system is supported. So anything you could do to activate the parasympathetic nervous system, the rest and digest nervous system is going to support. It's going to support digestion. It's going to support growth and repair. It's going to support good cognitive functioning and executive decision making. It's going to support heart health, and it's going to support the immune system. So relax, chill out, lighten up. One of the ways that we can relax is to give our body enough resources, enough nutritional resources. This is where the mighty 90 essential nutrients come. Under conditions of abundant nutritional resources, the body feels content and happy. Under conditions of nutritional deficiencies, it starts to mobilize defense mechanisms that ultimately will cause the immune system to become suppressed. So making sure you're loaded up with nutrients, vitamin C, vitamin E, vitamin A, essential fatty acids, the mighty 90 essential nutrients. Sugar, the ingestion of sugar hypes the body up. It activates the sympathetic nervous system. So high amounts of sugar have an immune suppressive effect. The average American eats 180 pounds of sugar a year. That's half a pound a day. Can you imagine half a pound of sugar a day?
Yeah.
I mean, that's absurd.
Yeah,
Some people don't eat half a pound. That means other people are eating like 3/4 of a pound of sugar a day, or even a pound of sugar a day.
Right.
So there's so many things that we do as a culture that conspire to suppress our immunity and make us sick. So of course we're going to become susceptible to infections. Of course we're going to become symptomatic when we get infections. By the way, as you pointed out, just because you're infected doesn't necessarily mean you're going to be symptomatic. You sent me this article, government model suggests U.S. COVID cases could be approaching 100 million. Yes, it's a virus. The nature of a virus is to spread. So virus spread, to hide from a virus is it's a silly and infantile kind of response.
Well, all these mitigation, all this mitigation that's being done, we're still looking at a doubling rate somewhere around 3 months, and we're still looking at this this close to exponential growth. We seem to be being shown that our mitigation strategies aren't really working.
Right. Right.
So that's nice. What I say to people, things about the concept of naturally acquired herd immunity, and I get jumped all over like I want to kill grandpa because I said that, and we've never done that before. We've done that because we didn't have a choice in every single viral infection that has ever happened. We did that in 1968 with the Hong Kong flu. We did that in 1918 with the Spanish flu pandemic. It's because we don't necessarily have a choice. We like to think we do.
Right.
I suppose everyone looks at China where there are, videos of people getting welded into their apartments, and they say, well, that works apparently. So
the welding into the apartments and the lockdowns and the masks, those are not to stop infections. Those are to flatten the curve,
right?
So the hospitals don't get overwhelmed.
Yeah.
Big spike.
Right. So
even these lockdown measures and these mitigation measures that they're doing that you're talking about, they're not to stop infections.
Right.
They're just to keep it so the infections are spread out over a longer period of time.
Yeah.
And whether or not that's a wise strategy as opposed to having a big spike, that's up for debate.
Yeah, it's widely understood by economists that when China says our GDP is growing at 6 or 7%, that what they really mean is 3 or 4%.
Well,
it's widely understood. So when we get data from China about how many fatalities they've had, we do know, at least there was reporting at the time, that they had these portable emergency incinerators brought into Wuhan to try and handle the load of bodies that were appearing. We do know that there were large shipments of tens of thousands of urns going to various crematoriums, but only 2,000 people died during that same period of time. So, I mean, we can believe the numbers coming from a country that consistently lies about every single number that they tell us about, and then we can say that their strategy obviously could be because right now they're throwing big festivals and parties in Wuhan, China, and they're just getting on with life. one thing could be that their case tracking is so good that they're able to isolate every single person. I'm not convinced of that. I would need to see better evidence. All of the circumstances seem to indicate to me that what they said is, okay, fine, herd immunity. What are we going to do? We'll just let everybody get it, and we'll hide all the fatalities, and then we'll be fine. But it's important, Ben, to realize what the scope of fatalities are with this. And that's why I was talking about that.
What do you mean by scope of fatalities?
Well, look, if you want to be conscious, you want to be rational. That's an aspect of being a conscious human. And one of the reasons why the news is so toxic.
What does scope mean? What do you mean by the word scope? You mean
how many people are actually dying from this as a percentage of the population, and also who those people are? Look, I love old people. I love my lots of at-risk old people.
Right.
But when a child dies.
Right.
When a 5-year-old dies, you lose 75 years of life. You lose the children they would have had. You lose an incredible, enormous thing. And it's part of the reason I'm always scared to death with my 2 little kids. When an 80 or 90-year-old person dies, they're pretty close to the end of their life anyways.
Right. I'm 60 years old, by the way, so watch out there, Jonty.
Well, you're thankfully an extremely healthy 60-year-old, but the cutoff in terms of where this disease is really severe is about at age 50 for the majority of the population.
But here, let's talk about that because you raised a good point.
Yeah.
So right now the figures are about 200,000 people, I think, something along those lines, supposed deaths. And I say supposed.
Oh, the United States is 385,000 in the U.S.
Okay. I said it's about 1%, right? 1% of the population. I'm sorry, 0.1%.
Yeah, there you go. Yeah.
Okay, it's 0.1% of the population, right?
Right.
Has died. Is that right? Am I doing the math right here?
That's pretty darn close. Yeah.
Okay, so
pretty good for in your head.
Yeah, so 0.1% of the population. 0.1% of the population. That means 99.9% of the population. 99.9% of the population is going to survive this thing. So we're talking about something.
It's better than that.
This is based on the numbers that we're being given.
Mm-hmm.
Okay.
Yeah.
And I say that because just because they say you died of COVID, as you know good and well, doesn't mean you died of COVID. Many people died with COVID.
Sure.
And that doesn't mean they died of COVID. You could fall out of a plane, but if you had COVID, that could mean that they're going to assume that on your death certificate it could say COVID, right? Not only that, but hospitals are deadly places.
Yeah. Right. Sure.
People die in hospitals. There's hospital-acquired infections. There's hospital procedures. There's the drugs people are given. And just the ventilators alone are a problem. So we don't really know how many people are dying of COVID. There's no way to know those numbers. And just because they give you these figures, how many people died today, doesn't necessarily mean they really died of COVID. So we have to get that out of the way. And we have to throw that out.
Yeah.
The bottom line is, what we do know is there's a virus. Some people are going to get sick from the virus. If your body's weakened, if you're elderly, as you point out, or if you're obese, or if you're smoking, or if you're on a lot of medications, your odds of getting sick and ultimately your odds of dying are higher. But there's factors that we can control. There's many factors that we can control.
Yeah.
And so life has infections. Do we want, this is really the bottom line, is how I see it, Jonty. Do we want the government to protect our health? Do we want to have our health mandated and regulated and controlled by this thing called the government to the point where we're locked in our house under penalty of law? Under law.
Right.
Do we really want a world where we are locked in our houses and we are told where we can go and what we can do? Our businesses are shut down in order to protect us. We're doing this for you. I don't want that kind of world. Right. I don't want that kind of world where I'm told what to do. I'm told how to protect myself and how to take care of my health.
Well, isn't that the exact thing that I just described earlier? Would you rather be a biological entity that needs to be corralled into the correct response, or do you want to be a conscious being that makes decisions based on your own ability to come to terms with the reality that you're faced with?
You know what, Jonty? I do and you do, but guess what? Guess what? The guy living next door to you probably doesn't.
Right.
You
and
know?
it's that limbic response. It's that fear thing, or it's a variety of strategies.
Much of the world doesn't want to take responsibility for their health. I told this story before. I don't know if I told you this, and forgive me if I'm repeating myself. In Denver, about a month ago or 2 months ago, the first In-N-Out burger opened up. Right? There were lines.
Oh yeah.
Were waiting in line
right.
overnight. They were camping out to get their In-N-Out burgers.
Yeah.
Okay. They were fighting. There were actually fist fights because people cut in front of people to get their In-N-Out burgers. Right. And so we live in a world where we don't connect what we're doing, our lifestyle choices, with our health. Most of those people would never in a million years think that a hamburger is going to be related to their likelihood of getting an infection. But it is.
Yeah, there was a lady who sued her doctor because the doctor said that her son needs to stop drinking multiple big gulps a day because that's what was giving him diabetes. She said, no, you have to provide a medicine that will prevent him from having diabetes. And she actually went to court to try and say that the doctor was not treating her. He was refusing to treat.
That's the world. That's the world we live in. And it's tough for me and you. We're not really surrounded with that. Most people that we're hanging out with are not really like that. So they know obviously that they drink lots of big gulps and they'll get diabetes. They know that if they're not exercising or smoking or they're overweight, that's going to increase their risk. But most people don't know that. And unfortunately, drug companies, the pharmaceutical companies, the medical model, people who sell various health pieces of health equipment like ventilators and oxygen tanks. They don't want to kill the goose that laid the golden eggs. We sell the diabetes business, the diabetes drug business is an $80 billion business. $80 billion for a drug that is taking care of a disease state that's directly correlated to what you're eating.
Right.
Do you think anybody who's making money off of that is going to tell people to just stop drinking the big gulps and eating the donuts and the pasta?
Right.
They're going to need the diabetes medicine.
Right.
So it's up to us. I believe it's up to individuals. It's up to human beings to make decisions for themselves. It's up to us to take our health authority. Authority, I love that word authority. I know I've talked about it before. Write our own health story. Authority means authorship. Our authority is we want to take our authorship back. We want to become our own authorities and write our stories. Our stories are being written for us now by health authorities, by government authorities, by legal authorities. They're writing our story.
Who all have a revolving door situation going on with the same corporations that are profiting ridiculously off of our varied responses to these sorts of situations.
Then
I think we should shut down Walmart and Amazon until the caseload starts dropping.
Do you know how much?
And then we see how.
Do you know how much money Walmart and Amazon are making now that the stores are closed or that the mom and pop shops are closed?
Well, they just got to eliminate all their competition. I mean, what a bummer for those guys.
Right. Exactly. This has been a big coup for centralization of money, for centralization of power. Money is because the richest 1%, the so-called 1%, they've done really well. It's the average person who's getting screwed here, but we can't blame anybody but ourselves. Remember Pogo? I have seen the enemy, and he is us. You remember that?
No, I don't know if I'm familiar with that.
Okay, Pogo was. You know who Pogo was? The cartoon?
No.
It was a cartoon, old cartoon. It says, "I have seen the enemy, and he is us."
Right. That sounds wise. So let's tell it. I want to tell a different story here. So one story that we're being told right now is the story that comes from the news, and the news says there are 220 million cases, confirmed cases. There are 380,000 fatalities. So 1.7% of all of the confirmed cases end up being fatalities. 1.7% is a pretty scary number. If you know 100 people and 2 of them are going to die from this, that's quite frightening. But what the CDC is also saying, but nobody seems to be paying attention to, as you see in that article, is that their estimate of the total number of people who've been infected but maybe didn't know they were infected or didn't get tested.
Much higher.
On November 25th, it was 100 million. You look at, and around that time, there were about 13 million confirmed cases.
Right.
And now we're now at 22 million confirmed cases. So we're somewhere in the order of 150 million, maybe even heading to 200 million infections out of a total population of 330 million. So
it's a virus.
So a different story is that I mean, if you look at if you just said our current number of fatalities divided by 100 million, you'd have a 0.38% fatality rate. So we're looking at 4 people out of 1,000 now. But then also you need to look at it by age group, because only about 5% of the fatalities are under 50.
Right.
So if you're under 50, or then you're looking at a fatality rate that's around about 0.02%. So we're talking about 2 people
out of 10,000.
2 people out of 10,000 if you're under 50. They won't go out in public and say these numbers because nobody's going to go along with these crazy lockdowns. If you're under 50, you're going to just say, I mean, if we just did have Woodstock right now, got all the young folks out there, have them get over it. Look, there are cases where young people get very sick. So I'm saying this in the context of in human history, we have never had a virus where we avoided getting to herd immunity naturally. Everyone says the vaccine's coming, but here's the secret. We're going to have herd immunity before people are actually going to get vaccinated.
I bought a book, and I've got to tell you the title of the title of the book. And I want to get the title right, so hang on a second. Okay. It's called The Contagion Myth. It's by a guy named Dr. Thomas Cowan, a brilliant, absolutely brilliant medical writer. He's a physician, and he writes books about vaccines. He writes books about cancer, and he's just unbelievably brilliant and outside-the-box thinker. And he presents that we don't even know if contagion is real. You know, and so there's so much stuff that's going, and I'm not saying I agree with them or disagree. I'm just telling you there's so many questions here that are involved in how we get sick, in the transmission of viruses, in what viruses really even are. And we're just it's okay to have questions, but to make public policy to the point where you're putting people out of business, where you're locking people in their houses, where you're keeping people from being able to exercise, where you're keeping people from being able to talk to each other, where you got this thing where everybody's wearing masks, and that's a whole nother story. And we have all of these questions, fundamental questions on the nature of infection itself, the nature of contagion itself. It just seems so unfair to me. And it seems so misguided. It's just talk to somebody who's been building his business for 30 years, and all of a sudden he's shut down and he has to he's bankrupt. He can't pay his employees. Or talk to somebody who has to pay bills, but he's out of work. He's a bartender, or he's a busboy or waiter. Or his restaurant is closed. You know, what do you do with these people? How do you justify this? On top of which, now they want to give you $600. The $600 thing. What? $600? Are you kidding me? They didn't want to give you $2,000. They want to give you $600. They're arguing over whether they should give you $2,000 or $600. It's just right. It's not. It's not human. It's inhumane, is what it is. And what really gets me is when you have medical professionals, talking heads on TV, saying not only that you have to lock down, you have to wear masks, you have to stay in the house, and you can't have Christmas dinner with your family. But now, and around the world, it's even worse. In the UK and in Australia.
A lot of Europe, Australia,
But now they got a thing where, boom, we got to stick things in your arm. That's what they say now. They say, we got to get needles in your arm. They call needles in your arm. Really? You have to get needles in your arm. Now, it's only it's not very far ahead. It's only a short jump to where you will be mandated to get needles in your arm. And even if it's not mandated like you have to, like the government mandates it, you're not going to be able to fly without it. You're not going to be able to go to concerts without it. You're not going to be able to go to restaurants without it. I mean, this craziness for something that we don't even understand whether it's contagious or not. You know, and I'm not saying I agree with the contagion myth, but I'm telling you there's fundamental assumptions that we're making that are leading us to making decisions that are affecting people in real time. We're making assumptions that are affecting people in their real lives to the point where they're locked in the house and they're losing their jobs and they're losing their businesses. And it just seems It seems really unfair to me.
Well, Ben, you mentioned being inhumane, and it occurs to me that part of our humanity is being lost here. There's a very important ingredient to humanity. In fact, it might be the most important ingredient to making us human, to making our lives matter, and that is, and it's something that we're losing, and that is the ability to die.
Well,
people used to die. People used to have 8 or 10 kids and hope that 2 made it. The fatality. I had this cool chart. I lost it. I was trying to find it. It was this chart of total fatalities from all causes over like 2 centuries, and the number of people that used to just die constantly was way higher than it is now. We have a higher population, but we're actually looking at lower fatalities per year, per annum, than we used to when people had. I'm not saying all. There's some diseases that we've managed to limit, like smallpox and typhoid and cholera, and there were some real great diseases that used to kill the heck out of us. This same disease, if you took this back 200 years, no one would even notice this.
That's true. That's true.
They'd be too busy dying.
The Black Plague killed 33%.
Yeah.
20%. 1 out of 4, 1 out of 3 people in Europe died from the Black Plague. That's kind of, we're lumping this thing into the Black Plague.
Right.
We're making it sound like it's the plague of some kind. It's a viral infection. Yes, some people are going to die, mostly people who are compromised. Occasionally you'll hear about people who weren't compromised, but you don't really know what was going on inside their body. But the vast majority of people who are going to die from this are going to be or somehow compromised. The vast majority of people who get infected aren't even going to be symptomatic. You know what I'm talking about? They're not even going to be symptomatic. That's the big problem, really, is people are scared that if you're and by the way, there's no proof that asymptomatic people can transmit, but that's the big concern.
It's interesting. I drilled down on that. I said, where's the actual scientific study that's talking about asymptomatic transmission? Because all over the place, you'll see people say, oh, it could be 50%. And I said, well, how do you know this?
We don't know.
All I could find was scientific studies that said we tried really hard to figure out a situation where we could prove there was an asymptomatic transmission. I mean, maybe there's a study I haven't read, but
the point is most people are going to be asymptomatic. Some people are going to be symptomatic, and those symptoms are going to be mild. They may get nauseous. They'll feel like crap for a few days. Of that group, some people will be severely symptomatic. And much smaller percentage will be severely symptomatic, and that, like your friend who said, it's the worst thing that ever happened. There'll be a small percentage, and then there'll be even a smaller percentage, God forbid, will be hospitalized, and then they may die. But it's like a sliver of a percent. And our response to this is more of a feature of our fear than it is to realistic numbers of what's happening in real life. So what I say is, let's take care of our bodies. Let's take care of our immune system. Let's activate the parasympathetic nervous system through relaxation strategies. Let's make sure we're supplementing. Make sure you're using the mighty 90 essential nutrients. Get out in the sun. This idea of staying in the house, that flies in the face of our understanding of the sun and the immune system. We know that a small amount of sunshine, you don't want to burn, you don't want to freak out in the sun, but a small amount of sunshine and vitamin D is very important for the immune system. We also know that ultraviolet rays kill the virus, for that matter.
Right. Right. But wear your mask at the beach, Ben.
Right, but you wear your mask. This is absurdity.
I'm down at the beach, and there's about 150 people down there, and they're all wearing masks.
It's absurdity.
It's
absolute absurdity.
I mean, I get the idea that if you have a mask on, it's going to limit the amount of things from coming out your mouth. I get it, but if you're
the virus is very small, it goes through the mask.
That's true. Exactly.
Wear your mask in the supermarket and walk past the laundry detergent aisle,
and you can smell it.
Guaranteed, you can smell it. Guaranteed, you can smell it.
And that's why we're over 100 million case of actual infections in the U.S. at this point, at least.
Do you vape?
No.
Okay. If you know somebody who vapes, have to do an experiment. Just do a little vape, put the mask on, exhale. Watch what comes out of the mask.
Sure.
Okay? And those particles are much bigger than a virus.
It might stop some things. It might prevent the spread. I get it. But if what's really going on in my mind is that we needed some kind of psychological indicator so that
Psychological.
people would feel okay still going to the
Yes.
supermarket. They wanted to keep Walmart open and Costco open, so they said, "Well, if you put a mask on, then
Yeah.
you'll feel better. You'll
Even in the
feel great while you're in there."
New England Journal of Medicine had an article in last March, where they called it a talisman.
Mm.
They said a mask is a talisman. It's a symbol. It's New England Journal of Medicine. Said masks are symbols. They're talismans. And that's fine if you want to have a symbol. That's great. You can have a talisman is used in witchcraft. That's great. And that's fine. If you want to have a talisman or you want to have a symbol, that's great. But to mandate it and to force everybody, to compel everybody under penalty of law, or or at least fines to wear a mask,
or penalty of groupthink, penalty of ostracization. I mean,
I wear. You know what? I wear a mask. You know why I wear a mask? Because people freak out if I don't.
Exactly.
So I wear a mask so they don't freak out. I'm around a lot of older folks.
Yeah.
And if I don't wear a mask, I heard a lady on TV. She said her grandfather died of COVID, and now she's a young girl. She's like in her 30s. She said now when she looks around, she sees people not wearing masks. She thinks, "Did you kill my grandfather?"
Yeah, right. I know exactly. There has actually been. I've read several articles where epidemiologists were saying it's very difficult to give this to someone outdoors at all. They're also saying very difficult to get it from a surface. That would be very hard to. There's no proven case of transmission from a surface. But neurotically wash your hands, please, and get the hand sanitizer and put it on every 5 seconds.
It's very difficult because a virus needs a cell for it to spread. If it's sitting on a surface and it doesn't have a cell, it's not going to survive.
How are you going to get a respiratory disease in your respiratory system from your finger? I mean, what exactly are you doing?
From a surface from a surface. Exactly.
Is it possible? It's theoretically possible.
Don't fear. That's the most important thing. And as far as this vaccine goes, oh my God.
You mean the mRNA situation?
This vaccine, it doesn't work like regular vaccines. Regular vaccines, they give you the antigen. They give you the poison. This new vaccine, they figured out how to have you make the poison. So instead of giving you the poison, now they've created a genetic technology where genes will be inserted into your body that will now go into your cells. Now they're actually going into the cell itself. The old vaccine, they didn't go into the cell itself.
Right.
Now they figured out a way to assault the cell, the living entity in the body, with the genetics. So now the vaccine will hijack your genetics, your RNA, which is a part of the genetic machinery, in order to have the cell make the poison itself. But that's not even the worst of it. Now you're a genetically modified organism, essentially. But that's not the worst of it, or that's only part of it. There's also the factor of components in the vaccine are required to protect the RNA. So now you're getting a witch's brew of chemicals that are designed to protect the RNA from degradation in the body. And this witch's brew of chemicals is manufactured industrially and synthetically with industrial processes that are bound to create contaminants and byproducts and other things that aren't identified in the polyethylene glycol and other ingredients that are in the vaccine. So we don't know what's in the vaccine, essentially. We know the ingredients, but we don't know about the byproducts that are in the industrially produced molecules that are in the vaccine. Because they're not listed on the ingredient tag, because they're in trace amounts. But this stuff's going right into your blood. So it's an unbelievably dangerous strategy, all in the name, check this out, Jonty, not to protect you from infection, not to protect against transmission, but to reduce symptoms. The vaccine does not protect you from getting infected. The vaccine does not protect against transmission. The vaccine only reduces symptoms. So we already said that most people are asymptomatic anyway. And most people are only going to have mild symptoms anyway. So what you're doing is you're protecting against an effect that's only going to affect a sliver of the population.
Let's just say it's completely safe, even though they usually test a vaccine for about 10 years before they release it to the general public.
I was just reading an article. I think I sent this to you. Vaccine rollout hits snag as health workers, as doctors and nurses balk at shots. Well, heck yes, they're balking at shots.
Yeah.
Because they don't want to be guinea pigs.
Yeah.
Because they know what's going on. The first people who use the vaccine, they're the test. Usually, like you say, vaccines are tested for years because you got to see what's going on over the course of time. This vaccine was tested for 6 weeks.
Yeah, and they're talking about 5,000. This is dating back. It's been probably much more than this now, but at some point they were reporting 5,000 confirmed severe severe reactions. I shouldn't say allergic reactions. I don't know that. And then I think it's in the U.S. two deaths so far. Europe's got like 4 or something.
Yes. So people, and this is just people who have allergic reactions. By the way, the testing that was done, as weak as it was done on healthy people. They didn't test elderly people. They didn't test people with autoimmune diseases.
Yeah. Well, why do you test for 10 years? It's because things are going to happen 2 years, 3 years, 5 years down the line that you're not going to see in this initial short period of time.
The elderly, who are the ones who are going to be the first people to get the test, you didn't test them on the elderly. So, and guess what? My mom can't wait to get the vaccine. She thinks the vaccine is like a magical force field that the virus is going to bounce off of.
Right.
And that's the implication. The vaccine is some kind of protective covering that viruses are not going to be able to penetrate through.
And as we've said in the past, Ben, the largest advertisers in the United States are the pharmaceutical industry. So if you're CNN or MSNBC or Fox News or you name it, your largest advertiser is Pfizer and Moderna and Johnson & Johnson.
Don't watch the news.
There you go.
And if you watch the news, I do watch the news. Watch it carefully.
Yeah, I watch it to see what I'm supposed to think.
Yeah, to see what you're supposed to think, right? To see what they want you to think. Exactly. Good point. Yeah, watch it to see what they're trying to tell you. That's a good point. All right.
Well, thanks so much, Ben. I don't know if we. I
hope we covered some good stuff there.
I hope we saved some lives. I hope we also saved some deaths.
Yes. But last thing, zinc, vitamin C, make sure you're getting out in the sun, reduce your sugar intake, excuse me, exercise, move your lymphatic system. If you feel like you're getting sick, jump up and down on a rebounder, go in saunas, far infrared or near infrared saunas, sweat it out. There's all kinds of ways that you can protect yourself from viruses, and even if you get infected, there's all kinds of ways that you can speed up your body's ability to deal with it.
That's for all viruses. That's not for this virus. That's for everything. Yes. Yeah. Fantastic, Ben. Thanks so much.
Good to talk to you.
You too. Bye.